For years, Coca-Cola and other soda companies promoted exercise as a way to fight obesity and argued that their products could be part of an overall healthy lifestyle. But recent science shows weight loss has far more to do with nutrition and that exercise, although extremely beneficial for other reasons, has little effect on weight. Public health advocates and medical doctors say that the soda industry's campaign to promote physical fitness was a calculated maneuver to shift the blame for its prominent contribution to the nation's obesity epidemic. Now, as soda consumption falls in the United States, Coca-Cola is backing away from funding its fitness initiative. But public health officials accuse it of exporting America's obesity problem to developing nations. Coke's exercise campaign was an example of trying to be slick, Sarah Bleak, a professor of public health policy at the Harvard T.H. Chan School, told Pulse News. Why are we getting heavier? We're getting heavier because we're taking in too many calories, not because we're exercising too little. Of all the different behavior changes you could do, there's probably the most evidence that if you drink fewer sugary beverages you would reduce your risk for obesity. There's a case to be made that soda companies are responding to a market demand for sugary beverages and have little obligation to promote the public's well-being. After all, Coca-Cola is a publicly traded company with responsibilities to its shareholders, not a government agency or nonprofit. But responding to market demand is different from fostering market demand. Coke and its competitors engage in multimillion-dollar marketing campaigns to encourage consumption of their products, which consist of flavored, sugary water with little nutritional value. Nowadays about 17% of children, 1 in 6, in the United States are obese and therefore at a higher risk of chronic health conditions, including cancer, type 2 diabetes, and heart disease. More than 1/3 of adult Americans is obese. Sugary beverages like soda and sports drinks are the top calorie source in the average teen's diet, 226 calories per day. Lauren Kane, Senior Director of Communications for the American Beverage Association, the trade organization representing Coca-Cola, Pepsi, Dr. Pepper, and other soft drinks, pointed out that all sugar-sweetened beverages combined only account for about 6% of the calories in the average U.S. diet. We understand that we make products that have calories, so we have a responsibility, but at the same time, you have to look at the obesity epidemic in the big picture, she told Pulse News. There are lots of different calories that people consume every single day. Gradually throughout the 2000s, as public awareness of the health risks surrounding soda and fast food grew, Coca-Cola started to pour money into healthy lifestyle projects, such as exercise and sports events. There's no doubt about it, exercise is associated with many health benefits for the body and mind. But recent studies show it has only a modest impact on weight. Aseem Malhotra, a cardiologist at Frimley Health NHS Foundation Trust in the UK, argues that the public perception that physical inactivity rather than poor diet is the primary cause of obesity was fostered by pervasive messages from the food industry. Coca-Cola has promoted the message that all calories count and associates its products with sports, but Malhotra's research in the British Journal of Sports Medicine shows that one cannot outrun a bad diet. The messaging of these companies such as Coca-Cola that gives the impression to the public that you can burn off the calories was not in keeping with the science, Malhotra told Pulse News. The evidence is very clear. At best, exercise has a very marginal effect when it comes to obesity. At worst, it's not linked at all. I would say we should remove exercise when we talk about obesity. The U.S. Federal Trade Commission found that American beverage companies spent about $3.2 billion marketing carbonated beverages in 2006. Nearly $500 million was targeted at teens and children as young as 2 years old. In 2010, children and teens respectively watched an average of 277 and 406 ads for sugary drinks and energy drinks, while preschoolers saw about 213. But those figures have dramatically declined, according to data from the Yukon Rudd Center for Food Policy and Obesity. The report says beverage company advertising to children and teens went down to $866 million on sugary drinks and energy drinks in 2013. Companies spent an additional $465 million to advertise diet drinks, 100% juice and plain water. Erica Kenny, a research fellow in the Department of Social and Behavioral Sciences at Harvard T.H. Chan School of Public Health, explained that this decline came after the industry's voluntary pledge to decrease marketing, but it wasn't universal, and some companies even increased advertising to kids. Given the beverage industry's frequent denials that these marketing tactics contribute to the epidemic, Harvard T.H. Chan School of Public Health assembled a fact sheet with key scientific evidence linking sugary drinks and obesity. It shows that more and more marketing has moved into